It's exciting to be here this afternoon to share in person some of the exciting things that we're doing within the traffic and arrest processing section. This particular presentation is going to focus on the virtual opioid dependency program at the arrest processing Spy Hill facility in Northwest Calgary. Myself and Staff Sergeant Blake Hebert wasn't able to be here today, but he's an administrative staff sergeant in that role of partners with me. I wanted to just talk a little bit about at the start, really the virtual opioid dependency program is a relatively new partnership with the government of Alberta, and it provides people who are suffering with addictions an option to have a virtual, voluntary, and private consultation with a medical physician at the site of Spy Hill in Northwest Calgary. So those people that come into our custody, we do talk a lot about in arrest process the importance of two things: being professional and respectful. Those are guiding principles for us, and the importance of the highest level of care and custody. And this allows us to meet with those people that are in need. Typically, we'll have just under 10,000 people every year coming through our facility that are from all parts and walks of life. And I say that very intentionally, that they are from walks of life and that they at times do suffer with addiction. In the past, we really haven't had those opportunities to aid them. But what this looks like for someone to logistically, as they walk through the door, it allows someone to, when they're experiencing the withdrawal symptoms, we have our full-time paramedical group that's there 24/7, 365, allows them to have that consultation and offer that opportunity to have a drug called, it's an evidence-based pharmaceutical called suboxone. It allows them to have, a virtual or voluntary private consultation with a physician. And they, approximately 80% of the people that we've been seeing through our door, the program has been, or through that have been taken, that have been experiencing these withdrawal symptoms, they are taking advantage of that. And so it's been started in Q4 of last year. We're still in the foundational stages of it, but we had very, very good results. Essentially, it mitigates number one, putting the person at the center of it. It allows them to get what they need and takes them from maybe a 9 of agitation right down to a 1. It allows them to start that process of recovery, which is really so important to make sure they're getting connected to what they need in our city. It also provides an opportunity for officers to have that risk mitigated, so we don't have to have heightened situations without reason. So again, we've had excellent results with it, and the lens that I've talked about with our care and custody, that's really this supports that. What's on the horizon? We have the government of Alberta has also put forward and I'm going to just click right here through there. We're going through the slide screen as we go. But at the end of the day, there's an addiction-focused healthcare provider that's going to be helping people get connected to what they need in their city. We're in the process of working closely with Alberta Health Services on that, and have an evaluation that's going to be likely through one of our universities to ensure that we have a really solid look at the year going forward. That's really a snapshot. At the end of the day, I know that it may generate some questions around this, but it really does tie into the service, the overall service, and Chief's goal of really heightening the highest level of care and custody and ensuring that on a provincial standard basis that we're very much aligned with Edmonton Police Service as well.